You look at a case like this and you look at her and you look at her smile and you say, why do you need veneers, right? It's like, look at those side teeth, the front teeth. There's really nice, pretty dominance. The canines look good. But if you look at this smile, this is why she came in. So let's jump into how we got here. You're going to see the exact preparations, the porcelain work, and the final. So if we're looking at a case like this up front, now you're like, okay, I understand. There's white lesions and throughout her entire mouth. The two front teeth are darker. And this other component of her tooth, which basically the goal of veneers here was to match her existing smile with just one little change. And that one little change that she wanted was to peak that lateral so that from the front, both the two laterals look basically identical. And obviously the most important thing is to eliminate that hypomineralization and the dark staining around her teeth. So, but if we look at how that flows along with her lower lip, that arch form right there is so gorgeous. So in this case, what we have to do is we essentially prepare this for an ideal and even thickness of porcelain throughout the entire smile. And that's how we get a very natural look. So if we look at this case, what I do in this here is I'm going to use a laser, peek this tissue right here a little bit. And since these are all the final lengths that essentially I'm going with, I have to remove about 1.5 millimeters from the edge over here. This one gets a little bit less because it's going down a slight bit. And just that front portion so that the veneer can slip right over. And so if you look over here, this side is untouched and this is a prepped side, right? And so the other thing that she had ever so slightly, if you can see from here, is this tooth overlap this tooth. So to make them even in the porcelain, I had to reshape that front left one ever so slightly, a little bit more, to make those two front teeth identical. So that's why we had that indent. So as I kind of rolled that in, but this is her final preparation of her teeth. That was the laser right there. And then essentially, this is where we went. We have the shade tab. That's critically important. So my ceramist knows exactly where the thickness of the porcelain needs to be in order to block out. And in her case, our goal was to keep it extremely natural. And so what I talk about oftentimes is, in order to do that, I like a gradient in the tooth, in the porcelain. And so what we see here is up top is one shade, in the body here is a slightly brighter pop to the color, and then we have a very natural translucency. But if we look, those steps between her central and her canines for that lateral is still there, extremely natural. The shapes, the premolars roll in a little bit more than they did originally. And this is where the work is in the temporaries, matching it to the permanents, making sure that if we asked my ceramist to have a round edge right there, that's exactly what we have here. If we wanted that canine to essentially have this type of sharp angle, that's the exact way that we roll that in. And these beautiful teardrop laterals. So that is half and half. Critically important to make sure that there are no guessing games, and both myself, my patient, are super happy. So this is the final product. This is what I talk about when I'm talking about a gradient, right? We have a very natural, a little bit more creamy, a little bit more yellow at the gum line, because that's how natural teeth appear. And then a nicer pop in the body with a translucency. And you can see the attention to detail with a few of these even kind of hypomineralization that give it more of a natural attention to detail. In this case, this is that final smile right over here. Again, you can see that these are a little bit shorter, and the gums, most importantly, healed absolutely beautiful. This is a year post-op photo. That's how that looks. This is where we started. Recall, this is the tooth that we wanted to change, but the lengths of these teeth and the sort of position that we wanted it to be along the smile line, maintained. That's where we started. That's where we finished.